For a brief period of time, maybe 2 or 3 weeks, maybe even less, the face bounces back in most cases and starts producing oils and other elements of the skin barrier in sufficient amounts to recreate that skin barrier that was lost. A considerable amount of my patients coming to the clinic with a problem known as the mixed face skin or the mixed skin. I'm sure that many of you have heard about it. Many of you actually have mixed skin, meaning an oily T-zone, meaning the forehead and the nose producing oils in adequate amounts or even excessive amounts, while the lower part of the face, the cheeks and the chin, are dry and sensitive and itchy and have all sorts of issues that are inherent to it. It's as if there's this invisible border between the T-zone and the lower 2/3 of the face that make that area of the skin very problematic. The thing that most people don't realize is that this problem is completely avoidable. That's right. Mixed skin is actually a man-made or a woman-made problem. How is that? Well, what I've found out after having seen thousands of patients who were afflicted with mixed skin, including myself back in the day, is that every single one of these people confessed to using some form of cleansing routine on their face, usually incorporating hot water, a detergent, and some form of a physical abrasive. All these elements combined together and launched at the face were a common denominator in every single person I've seen in clinic who had mixed skin. The conclusion that I drew was this: the T-zone is sturdy enough to actually put up with the abuse of the face of all these practices, which are not needed in any way, shape, or form. The face is not dirty inherently, and there's nothing really to clean. What these people are doing is stripping elements of their skin barrier. And the interesting thing is the lower part of the face is more sensitive. It's less resilient than the T-zone. And in people who have the mixed skin, that part of the face eventually succumbs to the pressure and stops producing enough elements of the skin barrier, and that's how you wind up with a mixed skin. So my approach was this: I actually challenged myself, and I challenged a number of patients to stop cleaning their face and back away from those cleansing practices and see how the mixed face would behave. And I'm very happy to report that by backing away from those cleansing practices for a brief period of time, maybe 2 or 3 weeks, maybe even less, the face bounces back in most cases and starts producing oils and other elements of the skin barrier in sufficient amounts to recreate that skin barrier that was lost, and that mixed face phenotype is reversed and evened out, meaning the T-zone stops producing excessive amounts of oil and gets back to normal, and the lower part of the face produces just what is needed as far as oils are concerned, so everything looks a whole lot more even. In certain people where the skin suffered a whole lot of abuse and was very inflamed, moisturization was very helpful, specifically with products like petroleum jelly or our shea butter balm, just to help things along and help the skin recover. And in very few cases where the skin actually crossed the threshold into inflammation, sometimes medical treatment is actually necessary, usually with topicals, and it really depends on the type of condition that you're contending with. And I would put that to your dermatologist to help you manage that. However, backing away from cleansing practices to the face, especially if you have dry sensitive skin or the mixed face phenotype, could be a game changer for you as far as facial skin sensitivity is concerned and the need to moisturize and care for the face. If you want to up the ante, I would back away from any products that are not absolutely necessary for skin health. Back away from those serums, back away from those toners, back away from those other cleansers and other forms of leave-on products. Trust me, you will not regret this. It'll be a game changer for you, and I dare you to back away from all these things and see how your face bounces back. If you've liked this video, don't forget to hit the subscribe button. Also, don't forget to share and like this video. For more information about how to take care of your skin in the most cost-effective way possible, pick up my book, Sick Skin, Skincare Made Simple, on Amazon.com, now available in audio. More great content coming your way right from this channel. Thanks for watching, and God bless.